My name is Laura Serbu. I'm an internal medicine physician and preventive medicine physician. And today we'll be talking about winter season and respiratory illnesses. Why do people get more sick in the winter? There are a couple of different reasons why people get more sick in the winter. The first one is that the air outside is colder. And so our lungs may react to that cold air differently than in different seasons. And certainly for people who are living with certain lung problems like asthma or chronic obstructive pulmonary disease, the cold air can make those conditions worse. The second reason is that the air inside homes is dry, and actually the air outside the homes is also a little bit drier than usual, and that can affect our lungs a little bit. But the main reason why people tend to get more sick in the winter is that people are inside more. Typically it's colder outside. We're not out and about as we usually are in different seasons. We have gatherings, and with more people being inside, it's just the best case scenario for viruses and other infections to spread, which we're a little bit more familiar with. I just wanted to briefly review the lungs. So I have a couple different images here, which will go in order from top to bottom. So the first image here on the left is the lungs from the outside. We have two lungs and we have a tube going down from our mouth into the lungs. The medical term is trachea. That's how the lungs look on the outside. If we were to see the lungs on the inside, this is kind of what we would see. That tube that brings in air from our mouth, from the outside world into our lungs, is split up into two different tubes, and then it keeps getting split up in smaller and smaller and smaller tubes until it reaches every section of the lungs, basically. And those tubes are different in different parts of the lungs, but essentially there are things like colder air that can affect the size of those tubes. So as a reminder, if we were going to look at those tubes just straight through them, as if we were looking through a telescope, we would see something like this, the normal airway, where the airway is open, there's no issues, air is moving in and out. But if we look at the orange tube on the top, the asthmatic airway, someone living with asthma, that airway, that tube can get smaller and smaller, and that obviously causes problems with breathing, causes issues with air going in and out. And so that's just something to keep in mind while we're talking about cold air and other factors that can affect the lungs, just as an example. So the same image that you saw before with the tube being open and also the tube being a little bit tighter, for a lot of people, cold air can make these tubes in the lung a little bit tighter. The lungs can react to that cold air. For most people, like let's say you're just going on a walk or going for a run outside, you may notice like, oh, it's a little bit harder for me to breathe initially, but you keep going and it's fine. So for most people, they can go about their lives in the cold air, no issues. However, for people who have asthma or chronic obstructive pulmonary disease or other lung conditions, where that cold air can be a trigger for them to get an exacerbation or get a worsening of their usual symptoms. So that's just something to keep in mind. If you're someone living with asthma or living with COPD, if cold air is a trigger for you to feel worse, to keep that in mind when arranging your day, layering up, having adequate layers. And as the body gets warmer, you can take off those layers, things like that. Now, moving on to dry air. Essentially, in the lungs, these tubes that I showed you earlier, there's a lining all along those tubes that makes the area a little bit moist. It allows for the body to use that moistness to maybe cough things up if there are things that are troubling the lungs or things that shouldn't be there. It's just very normal for the inside of the lungs to have this layer of a film of moistness. When the air outside is drier, outside the home, inside the home, what have you, it can dry up that moistness that's within the lungs, the liquid that's normally just kind of coating all the tubes in the lungs. And that can make it more difficult for us to cough up what shouldn't be there. And then it can put us at risk for developing an infection down the line. Again, that is the number one risk factor why people have more infections in the winter, but it's just one component out of these three things. Before we get into the last main thing, I did want to share indoor air pollutants. We think about pollution being outside the home with car exhaust, wildfire smoke. Just pollution is more typically thought of an outside issue, but there are actually things inside the home that can build up and can cause irritation to the lungs. Those things include scented products, candles, cleaning supplies that have scents to them. Using a gas stove also has components to it that can irritate the lungs over time. Of course, this is more commonly thought of, but excess dust, pet hair. Those things can also irritate the lungs and can be more irritating, of course, for people who have allergies to pet hair, for example. And certainly smoke, like tobacco smoke, can be a very common irritant to the lungs. This is just something to keep in mind when we think about lung health. This is also a factor not related to the winter season per se, besides that we tend to maybe have our windows closed more often during the winter months, but indoor air pollutants can happen year round. And the main reason why viruses and other infections, why people get more sick in the winter, is because the viruses have an opportunity to spread from person to person a lot more easily because more of us are inside. So while we're partying and having events, viruses are also having a ball because they're like, oh, I can go from person to person really easily this way. All of us being in this space, having a good time, like for New Year's, for example. What I have on the graph on the right here, it's a graph from the New York State Department of Health showing the cases of flu over different weeks of the year. So on the bottom here are the different weeks of the year, and on the left-hand side is just showing different numbers of cases. All these different lines are for different years. The tallest peak here is from 2022 to 2023. Essentially, these weeks start in October and end in May. This is what we consider to be flu season, the fall up until the spring, but concentrated in the winter. A lot of these peaks happen in December. So we're coming up on the portion of flu season. The different cases, the number of people who get sick with flu have been differing from year to year. The main point of even showing this chart is that people can actually get the flu year round. It's possible. There is flu around in the world, but it's mainly the winter time when we're all inside in close spaces, coughing and sneezing on each other, where the flu gets to spread. And that's when we get to see these increase in flu cases. And that's the same for other viruses. I'll summarize and emphasize the recommendations that for some of which I haven't yet got into, just to have it all in one go. So for cold air, if you're going to be moving around outside, it's important to wear layers to help the body warm up and not be as affected by the cold air. And just to keep in mind, even if you're someone who's perfectly healthy, it is normal to be outside in the cold air and be like, oh, I'm having a little trouble breathing when I'm on this brisk walk initially, but chances are you'll start to feel back to normal pretty soon. It's just the body adjusting to the cold air, and the body does a pretty decent job of warming up that air as it enters the lungs. If you are someone living with asthma or chronic obstructive pulmonary disease, just be aware for yourself if cold air is a trigger for you and to plan accordingly. I know we're entering a very cold stretch here, so if it's at all possible to run any errands during the warmer parts of the day or have a friend pick up something for you if it's really cold outside, or have something delivered if that's financially feasible, just to keep in mind to avoid the cold air being a trigger for an exacerbation potentially. For dry air, we can't really control the dryness outside, but certainly inside the home, if you're noticing that the dry air is affecting you and affecting your breathing to any extent, to purchase an indoor humidifier. I think the percentages is like 30 to 50% humidity for air. It can be helpful. So that is an option. And for indoor pollution, so again, an air filter can be helpful for this. And if an air filter is not an option or not available, it's important to open the windows in the home every so often. I know with it being cold outside, it can be tricky to balance keeping it warm enough. It can be a little hard to coordinate, but even just a crack of a window being opened every so often, especially when cooking with a gas stove or after finishing cooking with a gas stove, or especially when using cleaning products, if you're cleaning the bathroom and cleaning the mirror or cleaning the tub or cleaning the toilet, if you have a window in the bathroom, which I know not all of them do, to keep that open while you're cleaning and to keep it open as those smells leave the bathroom. And then the last part here is to keep in mind to do this only when the air quality is good outside. So I know we've experienced some wildfires in the area. So when that's happening, or if you have a weather app on your phone and it's saying that the air quality is not that good outside, that's not the time to open the windows. Try to avoid doing that and to open it when the air quality is improved. The main part of the recommendations are related to how to prevent a virus party while we're partying. It's important to do these things, to cough or sneeze in your elbow. If you're blowing your nose, to throw away the tissue and then wash your hands afterwards so that you're not spreading those germs around afterwards. This one is very tough, but it's important to avoid touching your face just in general. I remember reading that people have done studies on this, that people can touch their face least 15, 25 times an hour. That's a lot of times of like rubbing the nose or rubbing the eyes or like wiping something away from the mouth. Like it's very common for us to be touching our face, but those are the points where the virus particles or infection particles can be on our hands, and then it goes straight to our nose, and that's how it gets into the body, and then we start to feel sick. So related to that, it's important to wash the hands frequently. I tend to recommend after coming inside to the home, before cooking, before eating, obviously, of course, after using the bathroom. These are all important points to be washing one's hands. If you're not feeling well, I do still recommend for people to test for COVID and or flu, just in general, and especially before a gathering, whether it's family, friends, a coworker party, what have you. I think it's very important to just know for yourself and for others that, okay, I don't have flu, I don't have COVID. And if you do have those things, to definitely stay at home and to seek out ways to feel better, whether it's treatment for either of those, being seen by a provider, etc. If you're someone who tested and you don't have COVID, you don't have the flu, but it seems to be just a cold, so it's still important to consider staying at home. People don't enjoy getting sick, even when it's just the cold. Or an option is still potentially to wear a mask at the event if you're okay with wearing that throughout the event, for example. Some things to keep in mind. And as I said, out of all the things we've talked about today, the main reason why infections spread during the winter months is because we're all close together and we're spreading it from one person to the other with our coughing and sneezing and things like that. Of course, part of the toolkit to prevent infections from spreading is, in fact, vaccinations. It's important to get vaccinated against the flu. It's important to get vaccinated against COVID. For those who are eligible for the pneumonia vaccine, pneumonia is also an important vaccine to get. And lastly, respiratory syncytial virus, or RSV, is another one that vaccination is available for people over 60 or for persons who are pregnant. Just to review that long COVID is a condition that happens for some people after they get the COVID virus. They can experience long-term symptoms that can last for weeks, months, even years so far. And those who are most at risk are people who have not yet received the COVID vaccine or had a more severe bout of COVID, especially those who are in the hospital for their infection, and for people who have some underlying health conditions or health diagnoses. Unfortunately, there are people who have long COVID who do not have any of these things that happen to them. So it is possible to get COVID even if you're someone who doesn't have any medical conditions prior, which is very unfortunate. There are a lot of different symptoms that are connected to long COVID. They include coughing or breathing problems, loss of smell or taste, body aches, headaches, different pains in the body, issues with sleeping, issues with thinking and thinking slowly, also known as brain fog, fever, tiredness, changes in the mood. And unfortunately, there's no test to confirm long COVID. It's getting evaluated by the health provider and seeking out long COVID clinics that are in the QR code. Besides those main common symptoms that I already said, there are also 200 other symptoms that are connected to long COVID. For COVID, there's the 2024 booster available. It's recommended for people over 6 months old. I recommend it to the patients that I see as well. If you haven't yet gotten COVID vaccines, you can get 2 doses of Moderna or 3 doses of Pfizer to have the initial series. The 2024 season flu shot is also available. Would recommend. As you may or may have not have seen on that flu chart, the flu cases are starting to go up in the New York State area. It's not quite yet at the level that is the peak for the season. And so now is a great time to get protected before it's more present in the community and it's a higher risk to get sick. The respiratory syncytial virus, or RSV, I mentioned briefly, 1 shot if you're over age of 60 or if you're pregnant. And for pneumonia, recommended for all adults over 65. But if you have certain medical conditions, it's recommended even for those aged 19 to 64. Some people who are at high risk for a lot of these viruses and conditions that described on the right, people who are aged over 65, people who are pregnant or living with HIV, cancer, diabetes, heart disease, reviewing some of these core prevention strategies to prevent getting sick in the wintertime, but also year round.